So what did these diagnostics find? Well, in her chest ultrasound, there was small right apical pneumothorax, moderate left and small right pleural effusions, and babasilar atelectasis. Her echo found moderate pulmonary hypertension and tricuspid regurgitation, and these were ordered due to her cardiac involvement in her history. Labs, her troponins were in normal range, very small amounts. That can rule out heart attack. Chemistry is normal, UA, no UTI there. And CBC found high kidney labs, so a high BUN and creatinine due to her CKD history. I don't think I mentioned it orally, but it is on the slide about her having CKD. And then there was a venous blood draw. It's not arterial blood gases, but her CO2 was 41, which the normal range is around 24, so that's pretty high. And it's because of her hypoxemic acute respiratory failure. She's not breathing completely and fully, so that makes sense. Now let's look into the non-medicinal interventions for this patient so she can be discharged. So to monitor her throughout her stay, you can do pulmonary function tests, and this kind of goes along with diagnostic tests because they breathe into this tube and it monitors their respirations on a spirogram, and I have a picture down below. O2 sats, and this can be best seen with ABGs. And then lung sounds. So the nurse or the healthcare staff will do these throughout her stay to look at her improvement. And then more interventions are inspirometry use, deep breathing cough, ambulation if they're able to walk, semi-Fowler's position, Q4 vital signs, and tripod position to, open up those lungs. And then patient education regarding all of these interventions she can do at home. So now time for the meds. BP had 1 liter of oxygen, nasal cannula, acetazolamide for edema, it's a diuretic, vitamin C for overall immune health and tissue repair, midodrine because she had on the lower end of blood pressure, it's for orthostatic hypotension, heparin and aspirin just for DVT prophylaxis, a lot of patients get this. Same with Protonix, it's a prophylactic agent for stress ulcers. And then atorvastatin for her lipids and cholesterol level. Then for the general scope of COPD patients, they typically take bronchodilators to help open up the lungs, help them breathe more, in conjunction with corticosteroids as an anti-inflammatory agent, and then naturally oxygen therapy. And that wraps up my case study. I hope you guys all enjoyed it and that you're not as asleep as she is.